everyone, I wanted to give a 6-month report on my hand from the basal joint surgery that I had just a little more than 6 months ago. So, you know, the surgeons say these things take 6 to 7 months to heal completely, and I would agree. So just before I was at the 6-month mark, I was finally able to start doing push-ups again, you know, to put my hand flat on the ground. But before the surgery, I could do 15 regular, what I call boys push-ups in a row, and I do 5 sets of those. So now when I started over, I was back to doing 2. 2 push-ups and doing that 5 times. So 2 was 1 set. So now, right now, I'm up to 4, and I'm about ready to be able to do 5. So that was really something, because I could not get my hand flat for a long time. Now I'm still having some issue with how my hand looks, but the doctor doesn't think it's a big deal. So remember, well, for those of you who are having the surgery, you know exactly the surgery is in this joint right here, but I'm having an issue with this joint where, you know, when you compare it to my good hand, I don't know if you can see that, and I'm looking at a viewer over on this side of the lens. So it's just something that pops out a little bit too much, where I can bend this thumb really well. I can't bend this thumb as much. So yeah, so it's not nice and flat. Just the way this joint is moving is a little weird. Also, where they cleaned out the joint and then put in the tendon, I've got a little bump here. I don't know if it's scar tissue. I don't know what it is. It doesn't hurt. It's just a little bit, it looks swollen, but it's just, I think it's just, it's always going to be. I am getting more use out of my hand. Things that I couldn't do, I can do. I've got this one little lamp that on the base, the little switch is on the base, and it's metal and it's kind of tight. And for a long time, I couldn't turn it on and off with this hand. So now I can do that most of the time. So it's just these last little things that I haven't been able to do that I'm able to do. I really don't have pain in it anymore. I don't do the exercises with it anymore, although I'll find myself pressing back on this joint to see if I can just play with it a little bit to get it to go where it should. But it just could be an overcompensation that this joint is doing based on what we had done here. So yeah, I'm not rushing out to get my right hand done. I am right-handed. I actually have to have my feet done. Yeah, I do. So am I happy I did it? Yeah, probably, because this was, you know, these things, they're not going to get better on their own. They're just not. So it's just interesting to see how these things heal over time. Everybody's a little different. A woman I met last summer, she had it done 10 years ago, and she doesn't have this. You know, it did take her about 6 or 7 months to heal properly, but she doesn't have, I don't even know what to call that, where it's just not flat. But it's flat enough. Like I said, I needed to get back to doing push-ups because I just like to do weight training and that kind of thing. For a while, I couldn't do curls with like just a bar with no weight on it. I just couldn't hold it in my hand like that. But now what I would do is take 2 free weights, but I could do a heavier weight in my right hand, a lighter weight in this hand, and just do some light curls. But now I think I can do an 8-pound weight in each, which isn't much, but yeah, so I hadn't been doing anything, of course, so just getting back to some of the upper body weight training has been really great. I was really missing that, and as women know, as we get older, we need to work out our upper arms and all different kinds of exercises. So I really miss that. I think by the time I was getting back into doing those things, I was probably let's see, October, November, December, January. I was probably 3 months past the surgery, 3 to 4 months, and then I started doing some of those things with really light weights, and now I'm almost up to the same weights in a lot of things, and then lighter weights and other things. So I'm getting there, and I think you will too if you've watched the series of my journey on having this surgery. Like I said, everybody's a little different. It depends on what's going on inside. It depends on your surgeon. It depends on your physical therapy or occupational therapy that you have. But I hope that you're doing well. Check out some of my other videos by watching clicking one of the images on the right side of your screen, or mouse over the upper right hand corner. There's a little eye, and if you click it, you'll see some other videos on this same series. Thanks for watching. Bye.